The lack of mobility in cervical rotation is a common problem in patients with neck pain, and its origin is not always related to bone or joint structure. Imagine a patient comes to your office with neck pain and difficulty rotating or turning their head. When evaluating their mobility, you notice that their range of cervical rotation is limited, but there is no evident sign of joint restriction. If the problem is not in the bone structure, what is causing it? In many cases, this lack of mobility is due to alterations in the motor control pattern of the cervical musculature. That is, some muscles may be overactive, while others are inhibited or do not perform their function efficiently. This not only reduces the range of motion, but can also cause overloads and perpetuate the pain. For physiotherapists and other health professionals, identifying these muscle activation patterns is key to designing an effective treatment. Next, you will learn 2 methods to assess cervical restriction and rotation, and detect if the problem lies in the motor control of the involved muscles. Proper cervical mobility depends on coordinated muscle activation. When this synergy is disrupted, the result is a restriction in the range of motion, often accompanied by cervical pain or pain radiating to the upper limb. In a cervical rotation to the right, the correct synergistic pattern should be that the left econ should activate more than the left scalene, more than the right splenius, and more than the right econ. When this coordination fails, muscle compensations can occur that not only reduce mobility but also increase the risk of pain. Chronic or associated injury? For example, if the right econ is excessively activated during right rotation, it could indicate a deficit in the left scalene. These imbalances alter the normal mechanics of the neck, restricting movement and contributing to the development of cervical pathologies. To effectively address this issue, it is crucial to identify the altered muscle pattern and correct it through specific exercises or manual therapy techniques. Next, I present to you the 2 formulas to evaluate and understand the origin of cervical mobility limitation, helping you restore the normal function of your patient's necks. The first formula would be an inhibition of the agonist muscle. If the main muscle responsible for the movement does not activate sufficiently, it cannot generate the necessary force to initiate and sustain the rotation, which limits the range of motion. Let's go with a real example of cervical rotation to the right. In this case, the left E is the main agonist of the movement. If its activation is insufficient compared to the right, the result will be reduced mobility to the right. Notice the results. The left E activates much more than the right E. That is, we have an inhibition of the left E. As a consequence, there is less mobility in right cervical rotation. This deficit can also be compensated by other muscles, generating unnecessary tension and alterations in the neck's biomechanics. Solution: apply specific exercises to increase the activation of the left E and restore muscular balance in the cervical area. Second formula, now the opposite, excess coactivation of the antagonist. Another common cause of mobility restriction is the excessive activation of the antagonist muscle. In this case, the muscle wanted to relax to allow movement, but was too active, creating unnecessary resistance. Let's go again with a real example. During this movement, the right E acts as an antagonist, so its activation should be minimal to allow smooth rotation. However, if this muscle is excessively activated, it becomes a brake, preventing the neck from rotating normally. Look at the results. The right E is excessively coactivated, hindering the movement. The consequence is less mobility in cervical rotation. In this scenario, the right E is actively resisting the movement instead of allowing the left E to do its job. This dysfunction creates unnecessary tensions and overloads the cervical muscles, increasing the risk of pain and discomfort. Solution: re-educate the muscle pattern to reduce the coactivation of the antagonist and restore balance in muscle activation. Therefore, agonist muscles with low activation and antagonist muscles with excessive coactivation create a significant restriction in cervical rotation. These muscle imbalances not only limit movement, but can also lead to compensations, overload, and persistent discomfort. If these dysfunctions are not corrected in time, the problem can worsen, leading to chronic pain, postural alterations, and a higher risk of injury. Therefore, it is essential that you are able to identify the exact cause of the acquisition through an objective evaluation and neuromuscular re-education strategy. With surface electromyography, you can precisely analyze the activation of each muscle in real time and objectively detect these dysfunctional patterns. See you in the next post.